Here we are, a week into March. You might guess flu season's just about over. Not this year, and our next guest wants to emphasize immediate vaccination for those, especially at increased risk. Dr. William Schaffner is one of the country's top flu experts and works at Vanderbilt University School of Medicine. Good morning, doctor.
Hi, Mary. Good to be with you.
And we're hearing about the numbers locally here in Douglas County, and February was a doozy of a month. Why isn't it too late to be vaccinated?
Well, we're having substantial flu. It's a doozy in a bad way. It's not too late to be vaccinated because this virus is going to be with us through March and probably into April. And you know, it can protect people against the most harmful aspects of influenza, which can put you in the hospital and even kill you, I'm afraid. And we're particularly concerned about people aged 65 and older, pregnant women, and the very young. You know, for people aged 65 and older, we have some good news because there are now 2 flu vaccines. One's called an adjuvanted vaccine, the other one is called high dose, that work especially well in people aged 65 and older, giving them more protection. So it's so easy to get vaccinated. Just go to your pharmacy or to your healthcare provider. You don't need an appointment. Get that vaccine and get protected. It's not too late.
To underscore what you're saying, these options, have they been developed and approved specifically for older Americans to meet their healthcare needs?
Exactly. For older Americans, you know, as we get older, our immune systems aren't as strong. And both of these vaccines, the adjuvanted vaccine and the high dose, stimulate the immune system better. And so they've been shown to provide people age 65 and older with better protection against flu. So get those options. They're available to you, covered by Medicare.
There are a couple of myths, and I'm sure you've heard it all in your line of work, surrounding the flu in particular. People say, well, if I get the shot, then I got the flu anyway, or getting the shot is going to increase my chances of getting sick. I mean, there's all of this stuff. What do you say to folks who are still skeptical about getting vaccinated?
Vaccine is the best way to prevent the disease in you. We all know that the flu vaccine is not a perfect vaccine, but it's good. It prevents a lot of flu completely, and if you should get flu, even though you've been vaccinated, you're going to have, in all likelihood, a shorter illness, and you're less likely to get the complications of pneumonia, having to go to the hospital, or dying. As I tell my patients, you're here complaining. That's very good. You survived the flu, and the vaccine helped you survive.
Well, I know we're talking broadly to our viewers today who haven't yet been vaccinated, but especially those who are 65 years and up. So you touched on it. What do patients do in talking to their doctors and their pharmacists to make sure that they're getting one of these 2 specific vaccines?
I think they should just ask for those vaccines that are formulated for people aged 65 and older. If they can remember, adjuvanted is one, high dose is the other. But either of those gives you the best protection if you're 65 and older, but don't linger. We need to do this right away because you want to get that protection, because you want to get protected before the flu virus finds you.
Well, and I just feel like it seems by now, right, the flu is past. It's nothing to worry about, but this year seems different. Dr. Schaffner, thank you so much for joining us today. We do appreciate your time.
My pleasure. Get vaccinated.
Words to live by, Mike.